Hello, my name's Professor Ketan Dhatariya. I'm a professor of diabetes at the Norfolk and Norwich Hospital in Norwich in the UK. This short video is really to try and inform people about sick day rules, especially if you have type 2 diabetes. It's important when COVID-19 is spreading all over the world that people with diabetes who are at increased risk know what to do when they feel unwell. I'm sure most of you will have heard about sick day rules from your own providers of healthcare, but this is just to reinforce things. The first and single most important thing is if you take insulin, to never stop your insulin. The important things are because when you become unwell, your body can produce a number of different hormones that are actually going to raise your blood sugars. And if you stop taking your medication, and your blood sugars may rise even higher, in particular if you stop taking them, which is then a bad thing. Symptoms that you might get if you have high blood sugars, that you feel thirsty all the time, you're getting up to pee quite frequently, you just feel tired, and you may start feeling sick as well. The important things when you are feeling unwell is to look after yourself. So of course, take some rest. You need to prevent yourself from becoming dehydrated, and that means trying to drink as much as you can, about 100 mils an hour. You don't have to drink all of that in one go, but drinking small amounts and often all the time are really important. And of course, if you develop a fever with COVID-19, you should not take a non-steroidal such as ibuprofen, but treat your fever with paracetamol. You should also continue testing your blood glucose concentrations. This is quite important, so you should be doing it every 4 or 6 hours, even during the night. And if your blood sugars do start rising, then you need to adjust your insulin doses. If you can, you should try and keep eating a little bit. And things you can keep eating are things that you can easily swallow. So you could have a scoop of ice cream, for example. You could have some fruit juice, or you could have some milk. Tomato soup is always a family favourite, of course. Low-fat yogurts are good, or maybe just a couple of biscuits. Just something to try and keep your carbohydrate levels up a little bit to try and prevent you from developing ketoacidosis, which of course is the one thing that we're really trying to avoid. One of the things that's important with sick day rules is to not always rely on your glucose concentrations as a marker to tell you when you may be becoming unwell, especially if you're taking the class of drugs called the SGLT2 inhibitors. And those are drugs like canagliflozin, dapagliflozin, or empagliflozin. That's because the way those drugs work is they make you pee out sugar, and your glucose concentrations may be completely normal, but you may still become really very unwell with ketones. And so if you do have the ability to check your ketones, you should check them. If you take tablets like gliclazide, you may need to increase the dose to counteract the rise in blood glucose that's caused by those extra hormones. If you do take insulin, then if your blood glucose concentrations are between about 11 and 17, then you may need to just give yourself 2 extra units. But remember, if you take more than 50 units of insulin per day in total, then you should double that and take 4 units if your blood glucose is between 11 and 17. If, however, it's between 17 and 22, then you should take 4 units of extra insulin. But if you take more than 50 units, usually when you're well, then that could be 8 units of insulin at each dose whenever you're due to take it. And if it's higher than 22, you should take either 6 units or 12 units if you're taking more than 50 units. But certainly, if your blood glucose concentrations remain higher than 22, you should seek advice from your healthcare professional, or maybe even dial the emergency services if your ketone concentrations are higher than 3. If, however, you are pregnant, if you are unable to eat and drink because you are persistently vomiting, if you become drowsy or breathless, or if you have abdominal pain, or if things get worse, then don't wait around. You should ask for help from a healthcare professional.